Medical negligence cases in Nigeria are widespread, involving wrong diagnosis, delayed treatment, surgical errors leading to preventable deaths and injuries. Systemic problems like understaffing, poor equipment, and lack of awareness of fuel these incidents, and legal avenues for redress are often underutilized owing to poverty, illiteracy, and fear. Here's a timeline of widely reported medical negligence cases in Nigeria between 2020 and early 2026. In November 2020, an Abuja surgery became a nightmare when a doctor accidentally severed Irene's intestines. The error caused life-threatening complications and extreme pain, requiring multiple corrective procedures to save her life. On August 1st, 2023, days before finishing her internship, Dr. Diaso died when a faulty Lagos hospital elevator plummeted. Despite years of complaints about the infrastructure, the malfunction claimed the young doctor's life. Following a 2024 fibroid surgery, Beju Uboma died and was reported in 2025 due to alleged ventilator mismanagement in Lagos. The tragedy highlighted critical gaps in post-operative care and emergency response within private clinics. Tragedy struck the Alozie family on December 25, 2025, when their twin infants died within 24 hours of routine immunization in Lagos. An investigation was launched to determine if the administration process was negligent. On January 6, 2026, the toddler son of Chimamanda Adichie died in Lagos following an alleged anesthetic overdose. Inadequate monitoring during the procedure led to cardiac arrest just before his planned medical evacuation. Aishatu Umar died in Kano on January 11, 2026, after surgeons left scissors inside her abdomen. The oversight caused fatal infections and internal complications, leading to the suspension of the medical team involved. Now, to further discuss this, I'm joined by Dayo Adu, a managing partner at Moroom Africa. Thank you for joining us, Dayo.
Thank you for having me.
We do know that many times these cases are not reported. And is it a question of ignorance that a lot of people do not report? I mean, look at the cases we highlighted there. They are less than 10, but we do know that these cases are quite frequent across the country. Why do you think people don't go ahead to report these cases?
Well, it depends on the circumstance, and it also depends on the patients as well, and relatives of the patients. So in some cases, what will typically happen is, do I want to escalate this? The grief is there, the pain is there, and it's about what next. Because to meet the threshold of even proving medical negligence is quite steep. And when you see a family that's lost a loved one, culturally, it may be difficult for them to want to subject the disease to post-mortem. And, you know, we are also a very religious society, where in some cases what we just say is, oh, well, we have to accept this. It's the act of God, and want to draw a line and just move on. But what I would say is that I think it's time for sensitization, especially on the rights of patients. One of the things I think needs to be done as well is, perhaps for every facility you enter, there should be maybe sort of like an information on patients' rights at the reception or at the entrance of the hospital. That way, patients are able to glean and get information on what their rights are. It could be something that could be adopted across.
Dayo, if you can hear me, so that we can, because we really don't have time, so we really need to move real quick. I was going to ask you, using the most recent cases, you've talked about patients' rights pasted at the point where a patient can see it when they walk in. But let's use some of the most recent cases. Chimamanda Adichie's son, as painful as that might be, and then the woman in Kano whose abdomen had the scissors left in there.
Yes.
From the legal point of view, what makes these cases so significant?
So it's not about the people involved now. Healthcare should be equal. Access to healthcare should be uniform across board. I think to prove negligence, there are four core elements. there has to be a duty of care on the part of the doctors, which means that the level and the skill required must be there. If you take that, then for you to establish negligence in itself, there must be a breach of that duty. And how do you establish that breach? Which leads us to causation. You must determine what caused that incident, and that can only be done via a post-mortem of the body autopsy, as the case may be. So it is then that you can now lean on what the outcome is. So, for instance, if it's a situation where the person passed on, or was a situation where irreparable damage was done, the causation element is actually very critical to determining the negligence aspects of any healthcare worker that may have been involved.
But just before I let you go, beyond the oh boy, what legal responsibilities do the hospitals themselves have, and Nigeria's regulatory bodies? Are they even doing enough to check these issues of medical negligence?
I think on a state level, like we have a facility management and accreditation agency in Lagos State, for instance. They tend to go around the licensed hospitals. They are in charge of compliance. I also know that just a few days ago, the Minister of Health also set up what we call the National Task Force on Clinical Governance and Patient Safety, with a lot of protocols in place. The constitution of that committee is widespread. We have a lot of foreign trained Nigerian doctors in diaspora on that committee. We have professors here as well in Nigeria on that committee. So with all of this coming into place, I think I'm a bit, it's hopeful. It's good that we have a minister that listens, and that also feels the pulse of the people and has swung to action to set up this committee. So let's give them a bit of time. We also have a national health facility regulation bill at the National Assembly, which has passed second stage. And I think at the public hearing stage, will be very critical and important for us to have sensitization. Right. And for both the public and the private sector stakeholders to be carried out.
All right.
So it's a team effort. I think it's all about the laws, the execution of the laws, the monitoring, and of course, the patients understanding their rights.
All right, thank you very much. Dayo Adu is a managing partner, Moroom Africa, who's also a lawyer, but in the medical field, quite versed as well. Thank you very much.